Hi, good day. My name is Baling from BSN2-WIEDENBACH. For today's video, I am going to show you the procedure about assisting in catheterization. There are two types of catheterization. Number one is the straight catheterization and number two is the indwelling catheterization. And what is the definition? It is assisting in the introduction of a catheter into the bladder through the urethra for the relief of urinary retention or for emptying the bladder completely. There are 10 objectives. Number 1, to relieve acute or chronic urinary retention. Number 2, to promote urinary elimination. Number 3, to obtain a sterile specimen. Number 4, to obtain accurate measurement of bladder function. Number 5, to provide continual urinary bladder drainage. Number 6, for pre-operative and post-operative drainage. Number 8, to measure the amount of residual urine after voiding. Number 9, to monitor the output of critically ill patients. And lastly, is to prevent skin breakdown in incontinent, bedridden patients. Now, let us proceed to the procedure.
Step number 1. In preparation of equipment. Obtain treatment card from the nurse and check with doctor's orders. This helps to save time and effort. Step number 2. Bring equipment to bedside table. After that, check lighting source. Now, proceed in preparation of the patient. Step number 1 is to identify patient and explain the procedure and need for the patient to keep knees positioned during procedure. Describe pressure sensation that will be felt during catheter insertion. Patient will feel reassured if the procedure is explained and if she is handled gently and considerately. Next step is to screen the patient to provide privacy. This reduces client embarrassment and aids in relaxation during the procedure. Next is to place bed in high position and lower side rails and working side. This promotes use of proper body mechanics. Next is place patient in dorsal recumbent position if female and bring knees up and out and may need assistance to keep knees in the position if male. This position provides for good visualization of the urinary meatus and perineal structure. Next, let's proceed in draping the patient with top sheet. To expose perineum and avoid unnecessary exposure of body parts and maintain client's comfort. After draping the patient, assist the patient to side near you. After that, loosen foot part of the top sheet. Next step is to use the diagonal draping. This helps expose perineum and avoid unnecessary exposure of body parts and maintain client's comfort. Next step is to provide perineal care if needed. Presence of microorganisms near urethral meatus is reduced. Step number 7 is to place tray between thighs facing foot of the bed. This provides easy access to supplies during catheter insertion. Next is to adjust drop light. Flashlight may be used. This permits accurate identification and good view of the urethral meatus. After that, place waste receptacle at an area near you. After that is to wash your hands because this prevents the spread of microorganisms. Next, in opening the sterile pack. A. Grasp its corners and open it with care, touching only the underneath sides and edges. B. Bring edge of cover under buttocks if able. To provide sterile field and to prevent transmission of microorganisms from table or work area to sterile supplies. Next step is to let the doctor open the pack of sterile gloves to put on gloves. This allows doctor to handle sterile supplies without contamination. Next is to observe sterile technique in offering pack of towel and with hole for draping. This helps maintain sterility. Place adequate amount of lubricant over the non-dominant hand after the doctor cleanses urinary meatus. Pick folic catheter or size according to age and remove outside pack, observing sterility, ensuring that the tip of the catheter will be offered for lubrication and insertion. Outside pack is unsterile. Doctor will pick the tip of catheter for lubrication. Step number 16 is to instruct client to breathe through the mouth while doctor inserts catheter to the urinary meatus. Relaxation of external sphincter aids in insertion of catheter. Place distal end of catheter in sterile bowl to measure urine volume or attach the drainage bag as indicated. Offer 10 cc of syringe filled with distilled water to the doctor to inflate inflation balloon. Attach end of catheter to collecting tubes to drainage system unless already connected to bag. Place drainage bag in an abandoned position. Next is to tape catheter. In female client, tape catheter to the inside of the thigh with strip of non-allergic tape and allow for slack so that movement of thighs does not create tension on catheter. Anchoring of catheter minimizes trauma to urethra and meatus during client's movement, and catheter positioned over the thigh prevents kinking. Non-allergic tape prevents skin breakdown. Be sure there are no obstructions or kinks in tubing. Place exhaust coil of tubing on bed and fasten it to bottom sheet with clip from drainage set or with rubber band and safety pin. Next is to assist the client to a comfortable position. The client's comfort and security should be maintained. Instruct the client on ways to lie in bed with catheter, side lying facing drainage system with catheter and tubing draped over lower thigh, side lying facing away from system and catheter and tubing extending between the legs. Step number 8 is caution client against pulling on the catheter. This reduces the trauma to urethral meatus. After that, the nurse should wash her hands because this reduces spread of infection. Next step is to palpate bladder and ask if client remains uncomfortable. This determines if distension is relieved. Observe character and amount of urine in drainage system. This determines if urine is flowing adequately. Last is to record the type and size of catheter inserted, amount of fluid used to inflate balloon, characteristics of urine, and amount of urine. This communicates pertinent information to all members of healthcare team.